As the weather gets colder and people start to gather for the holidays, people start passing around those common diseases, and especially so in schools. Our 90s health expert, Dr. Payal Kohli, joins us now to talk about what you need to know to keep you and your family, your kiddos from getting sick. So let's start with hand, foot, mouth. This went, both of my kids had it, and it is a gnarly disease.
It is gnarly, ladies, and it is really common. So one of the most common viral illnesses under the age of 5 and under the age of 10. They say most kids by the age of 10 have had it at least once, if not multiple times. And so let's talk about it. It's caused by a family of viruses called enterovirus. And what's difficult about this disease is you're shedding and able to spread it before you have symptoms, and for a long time even after you have symptoms, a couple of weeks after. So you can imagine in a daycare where kids are gathering and they're spending a lot of time together, and it spreads by respiratory droplets, by saliva, and by fecal oral spread, which means if somebody goes to the bathroom, wipes themselves and doesn't wash their hands but touches something, you can certainly get it from there. We tend to see a spike in the summer and in the early fall. It's a tough disease because the kids can really complain of those painful blisters.
Oh my God, in their mouth. Ava had like these huge sores in her mouth and her hands and her feet. She was like, Mommy, my mouth hurts. It really was a horrible experience.
And you must feel so helpless as a parent. So what can parents do to recognize these symptoms? And I know that the symptoms come almost when it's too late.
Yeah, so it's interesting, exactly what Alex said. This is the classic presentation. Starts out like a cold. So you have a runny nose, you have a sore throat, you're under the weather. That's about 2 days. And then you start to get those mouth ulcers. Now, for anyone that's ever had an ulcer in their mouth, you can imagine you don't have one, but several. So sometimes kids will refuse to eat, refuse to drink, start drooling. And then you can get that characteristic rash on the hands and the feet. This is a blister. They're not itchy, but they can be very painful and tender. And those blisters are also infectious. So if they rupture, they can actually also spread the virus too. So that can happen. And then they can shed it in their stool for up to 2 weeks after.
Oh, wow.
So even after all that stuff clears, the rash is gone, it's really important for mom and family members to make sure they wash their hands, especially if they're sharing the same bathroom. But a tough disease, and we don't really have any treatments for it. It's so common.
I have a question that I've been dying to ask you, because now we live in a 2-kid household. Every single time one kid gets sick, the next is just like inevitable. The next one gets sick. Is there anything you can do? Because it's impossible to keep siblings apart. They want to play. And they're coughing in each other's faces and all that stuff.
So we don't have a vaccine for hand, foot, mouth here in the U.S. We do in Asia, but there's not one here in the U.S., unfortunately. But I would say, thankfully, it's not as infectious as COVID and flu and some of the others. So they can play in the same room, but try to keep their stuff separate as best as you can. So if they're touching something, especially if they touch their mouth, you want to make sure they do that separate. Try to split their bathrooms so they're not using the same bathrooms, especially toothbrushes and hair combs and anything else that requires a lot of contact or touches their face. And try as best as you can to put them in separate beds too. If they share a bedroom, that's a way that they'll spread it as well. The parents also need to be really careful, and you need to think about how to, make sure that if you are coming into contact with the child that's sick, that you're not touching your face, washing your hands, doing all the things we talked about.
Okay, so we're going to now move on to something else that's popping up in different schools right now. Head lice. Okay, so what do we need to know about them? How do you even get them?
Yeah, these little bugs that basically you get through crawling. They can't fly or jump. So it has to be direct head-to-head contact. So myth about head lice is that they jump, and you can't actually get them just by being in the same room. You actually have to have head-to-head contact. And it's very common, again. It doesn't have to do with the dirtiness of the hair, but it does have to do with close contact. And so once you get the head lice, they're pretty responsive to treatment in terms of getting rid of them. But if you're sharing combs, if you have your hair down, if you're a little girl that has your hair down, they're more likely, if you come close to someone else to touch, go to daycare, you could share a jacket or share a comb. They can live on surfaces, obviously, for 48 hours.
That's what I was going to ask. They can like get in a hat, you share a hat.
Exactly right. Or like crawl down your jacket and somebody else puts on the jacket or touches the jacket in a backpack or what have you. But if you have them, the good news is that you don't need to burn everything at home. You just need to tie up everything for 48 hours. So like, let's say the kid played with a stuffed toy and you can't wash the stuffed toy, just put it in a bag for 48 hours. Or of course the bed sheets and such, you do want to wash those in hot water, any utensils, any hair combs. And the way you get rid of them is by putting in the shampoo and you have to do that twice. So first time and then again a week later. And then using this comb to comb out all the eggs. And sometimes those eggs are the telltale sign, the little...
I'm itching just listening to her. I literally am.
Nasty. It's going around my kid's school right
It
now,
is.
so I'm like, okay,
Is it?
we're on lice
And so,
control.
and
Yeah.
the CDC and the American Academy of Pediatrics say you don't have to be lice-free to go back to school, which is why it's really important, just like they say about the blisters, just cover up the blisters and send the kid back to school, because you can't keep them out of school for
Maybe
so
just
many
keep the
weeks.
hair up when there's an outbreak.
That's right, and let the teacher know, so that the teacher is careful about letting other kids close by. So you want to kill all the live lice, but you can still have the eggs there. As long as you've gotten one treatment, you can send your kid back to school. So if it is going around the school, make sure you talk to the teacher about which kid has it, and just talk to Ava and say, oh, don't, rub your head against.
No head rubbing, hey,
No head
I
rubbing.
can try, Dr.
No sharing
Kohli.
hairbrushes.
I can try. All right, very, very good and useful information from Dr. Kohli as always. Thank you.